Hello, my name is Kayla. So the topic that I chose was access to mental health. And I think that it is an important topic to kind of discuss and address because having access to mental health is kind of the foundation of everything. Because in order to kind of talk about mental health and help people out is to give them access to mental health resources. So I think that this is kind of the foundation and like the first step into helping people with mental health. Um, and so I'm just going to discuss the factors that go into people not having access to mental health because that kind of ties into the impact on the healthcare quality and client outcomes. Because when you obviously don't have access to mental health, you're not going to have good outcomes. Um, and so some of the factors that go into not having that access to mental health is stigma surrounding mental health. So obviously, people are not wanting to talk to someone about mental health because of the shame and judgment they get from this diagnosis or condition, like depression or anxiety, and just people saying, like, oh, I'm not crazy and stuff like that. So there's this stigma around mental health. Um, People also just not realizing that what they're experiencing is a mental health disorder. So you might have someone that maybe they were abused as a child and they don't realize that because of that, now they have trauma, they have depression, they have anxiety because of that, and they just kind of think that it's normal. So you just kind of have the lack of knowledge of a mental health disorder. And so you have these people that are not wanting to get help or not realizing that they need help. So they're not getting that access to mental health resources. Um, and then another factor is health disparities. So you have the vulnerable populations, including low income, poverty, you have low education, minorities, the elderly who just have struggles with just also in general getting access to healthcare. And so when you don't even have access to healthcare, you really don't have access to mental health. And that is the issue as well, is because mental health is healthcare. And so you have these people that don't have access to either, but it's technically should be one. And so these vulnerable populations, like low income minorities, they struggle with getting to their doctor's appointments with because of transportation issues, or they have work that they have to be at in order to pay for everyday things. Then they have children that they have to bring to school and maybe they don't have daycare. And so you kind of just have conflicts, especially for these vulnerable populations. They are not able to get to their mental health resources or even to talk to someone about these resources. And so these kind of factors play into the not being able to have access to mental health. And in this is going to in turn affect healthcare quality or patient outcome because not having access to mental health is going to lead to more hospitalizations, because these people who are experiencing depression, anxiety, PTSD, schizophrenia, bipolar, they're not going to go to the doctor when they're in a kind of like a normal state. They're going to the emergency room when they have a severe episode. You have like a severe manic episode or a severe psychosis episode. That's when they're seeking help. And so you have this like very severe mental health um, condition or disorder that could have been addressed in the early mild stages of their condition. And so that's kind of why, and like having that access kind of prevents hospitalizations. It also having no access leads to patients going to self-harm and suicide, and like I mentioned earlier, going to those psychotic episodes or manic episodes because they're not getting the treatment or the management that they need for their diagnosis. So then and going off of that as well, when you do have a diagnosis and it's not getting treated, it can also lead to other diagnosis or multiple diagnoses of mental health disorders because it's just almost your mind is just kind of not being treated, basically. And this goes into the impact of the safety of the patient as well as other people because, like I said before, these people are not getting access when they are in the milder stages of their conditions, and they are getting help when they're in a very severe part stage of their condition and therefore leading to self-harm, psychotic episodes, and that can lead to like unsafe conditions for the person as well as other people around them. So now I'm going to talk about some policies and laws regarding mental health access. And the first one is the Mental Health Parity and Addiction Equity Act. So this is a major one that kind of requires insurances to bill people and not have limitations or restrictions and kind of treat mental health just like they would as surgery and medical conditions so that there's this kind of balance and just fairness as to mental health payments and like surgeries so that it's not unfair for people. And then the Affordable Care Act also provides coverage to people with mental health and substance use. So both of these are really, really important in having access to mental health, and there should be more resources that give people help to get access to mental health because mental health is physical health because when you have a decline in your physical health, you also have a decline in your mental health and vice versa. So treating a person's physical and mental health is treating the whole person. And I feel like that is something that a lot of people kind of try to disconnect is mental health and physical health are two different things, but it's almost like it's like one whole thing because you need to treat the whole person, and that's their physical and mental health. And so I think as a nurse, it's really important to educate patients about the resources available to them, as well as advocating for people and the patients that, hey, mental health needs to be addressed and it needs to be something that is a part of their care plan because, like I said earlier, their mental state is going to improve their physical state. So it's important when we're caring for patients to also address their mental health concerns and just trying to have more like telehealth visits, primary care, kind of address these mental health concerns so that patients have really easy access. So telehealth is kind of becoming more common, and providers are offering video visits and phone call visits because people do, like the vulnerable populations I mentioned earlier, have troubles getting to doctor's appointments. So when you have the offer of providing people with videos or phone calls to discuss these mental health conditions, it's a lot easier and like better for the patient because a lot of these people are scared to go to the doctor and talk to someone about this. But when you kind of have this like almost like phone call or video visit, it's kind of more casual. So I feel like people are more interested in doing telehealth than going to the doctors, as well as having screenings done and more early prevention care, like having this screenings done with children to prevent this from going to when they're adults, basically, is going to prevent someone from having a mental health condition that is worsening because when you're addressing it early, you can manage it better and treat it fast and earlier. So I just think education is really, really important to patients, to nurses, to providers that mental health needs to be addressed and it needs to be advocated more because there's this huge stigma and there's lack of resources, and this is overall impacting patient care. So I really think this is an important topic, and I enjoyed doing research on it, and it was helpful for me to understand that there is a struggle with access to mental health, even though there shouldn't be. Thanks.